Okay, guys. So I think we should start, and anyone else can join in the meantime. I'd like to welcome each and every one of you joining this afternoon for our symposium about migration and health. My name is Maki, and together with Elena, Rakan, and Ninka, we've organised this event with some help from IFMSA and the Global Health Unit of the University Medical Centre of Groningen. Before we begin, I'd like to ask everyone to turn off their microphones and their cameras for the duration of the symposium. If you have any questions, type them in the chat. The moderator will read them out loud to the speakers. So a short introduction to the timeline of today's event. We'll start off with an interview with the photographer Yousif Shewaili, who will talk about his experience in the refugee camps of Moria and Lesbos. Dr. Stefan van der Vijver will also talk about his experiences in working in several refugee camps as well as in Lesbos. We'll also have a presentation from Dr. Nasratullah Ansari, an epidemiologist at Simona Gozen, and then there'll be a short panel discussion between the two of them. We'll then have another short break and then another interview with Rakan and an anonymous guest who is also a refugee from Yemen who has migrated to Europe. And then we'll also have, after that, a presentation from refugee law professor Viola Bex-Reimers. And before we close, we'll have some readings of some poems written by Parvana Amiri, a refugee. So I think with that, we can also begin.
I'm happy this was in Greece for 3 years now. Since I am training Thailand as my home, second home.
Yeah, thank you. You're saying your second home, but can you tell us something more about your Iraq? And I heard in other interviews you had jobs there, like. Tell us.
I love Iraq. Look, it's my paradise, you know. Going through everything, you know, when you grow up in a country with your family, you will always keep it in your heart. So, in Baghdad, I had amazing time with my family. We were all of us here from each other. I was a football player, like studying in the school, of course. At the same time, I was a football player. That was my father dream to see me in the big screens for the national teams. So I did my best to let my dream and my coming through. I was in the Iraqi national team, under 17 years old, and I have a golden medal in Ajiku.
Oh, wow.
I'm champion. Then 2016, it's the point that changed my life. I had a really normal, calm life, you know, like my family, my school, my hobbies, and playing football, like everything was more than perfect, even like it was not a safe place. So I decided to go as a volunteer in the army to kill the killer of my father. I was a minor, so I was just angry, sad, all these feelings. So I decided to go to the volunteers army. So I went to the war for 6 months, but I saw a lot of ugly things going on. Like even they kill everyone, you know? They don't kill only the ISIS. I'm talking about the volunteers, Iraqis, the heroes, that they were heroes in Iraq. Until now, there's people seeing them as heroes. They were not heroes, they were killers. Even like the innocent people get killed by them. So I was with them. They thought they are heroes.
How old were you then?
I was around 16, 17. Like 16, but I didn't arrive to 17. It was the same year that I will be 17. And like even one time they killed a woman, a pregnant woman, because she get raped by an ISIS guy. So they said she's carrying little ISIS in her belly. So they just killed her in front of me. So after this moment, I stopped and I returned back to Baghdad and I start to do something to change that. It was horrible, like they are stealing people, killing people. Even the Iraqi volunteer army was raping women there. So I tried to change something, as you know.
And how was the rest of your journey to Lesbos, the crossing of the Mediterranean? Can you tell us more about that?
I will start from the beginning. So it was easy from Iraq, you know. My mom made a permission to one of my neighbors, and with this, I was a minor. I'm not allowed to travel by myself. So I went to Turkey, from Baghdad to Turkey by airplane with my passport. Like everything is normal. So I thought I will stay in Turkey, crossing the sea here, because I was looking for something near from Iraq actually. So my mom can visit me, or I can visit my mom. And Turkey, you know, like there's a lot of mafias. Like they call anyone, people are without work there, you know, like there's no lot of money. So the mafia call any person there with a bad background, and they tell him like, kill this man, this name man with this picture. They will get this amount of money. They will do it. There's a lot of people with bad backgrounds and bad backgrounds in Turkey. So I had to escape to Izmir. I stayed in Izmir like for 2 nights or 3 nights. Then one night the smuggler said, "This is your night." Well, the smuggler, I was in a small van, and we were around like 39 people in this small van. It was horrible. 5 hours I was sitting like in a crazy way. So when I get
you were still a child during all of this.
So we arrived to the place. We took the boat. We start to drive. In the middle of the sea, the boat gets blocked. So it was women screaming. I see the lights of Turkey and the lights of Greece. It was the airport's lights, it was red lights. And then the moon, you know, there's a moon and the light of the moon on the waves of the sea. I don't know how to swim. I had 2 life jackets. Circle one that they put it in the tire, I don't know how to call it. And the normal life jacket, the orange one. Women screaming, children screaming. We are in the middle of nowhere in the sea.
Did you have any phones, any connection to call for help? Or...
We cannot call anyone. Otherwise, the Turkish Coast Guard will catch us.
Of course.
We cannot even take it out from the airplane mode. So then I hug my backpack and I start to cry. Like I'm dying. You know, this is the moment that I'm dying. I was thinking then the Coast Guard came, the Greek Coast Guard, after 10, 15 minutes. They took us. They bring us to Lesbos.
And then you arrived in Lesbos and you thought you finally made it to Europe. But can you tell me something about the first impression of Moria camp?
Yeah, at that time. So I saw walls, barbed wires, fences. People look so dirty. People look so angry. People look sick. So we entered. They put us the first night in the reception tent. There is a tent called the reception tent. We were hundreds of people. It was supposed to be like 50. We were hundreds of people. Old people, young, children, women, men, different nationalities. It was crazy, more than crazy, you know, like all of them are angry, like they get shocked, you know, they surprised, and all of them, they had trauma from the sea.
Of course.
They faced death. Not only my boat, 90% from the boats are getting worked in the sea, you know. It's like just a plastic boat, so it was really horrible.
And can you tell us more about how Moria is for people who have never been there, before the lockdown and before the fire?
Moria. It's the worst place in the world. It's a city. It's a completely city. It's not a village. It's a city. You know, you find the good people, you will find the bad people. You will find business, you will find poor people. You will find dead, you will find victims, you will find strong people, you will find ambitions, dreams, you will find everything. Everything. And do you know what is the most special thing in Moria? It's the people of Moria.
Yeah.
I never saw a city with people from a lot of different nationalities are living together, peace, and they still like fighting and fighting and fighting, all of them like one hand, better future. I never saw that. This is the most special thing in Moria. As Moria, as a camp, it's the most camp in there.
And the lockdown happened in March, if I
In
recall
March.
correct.
Yeah.
And they start.
Until
How
December.
many people were living back then in Moria?
21,000 people
21,000.
stacking in the same area. This camp is supposed to be for 3,000 only.
Exactly.
And there's no masks, no water, no healthy food, no gloves, no sanitizers. There's nothing. And they
Nothing.
left them there to die.
So during the lockdown, the people in Moria were not allowed to leave the camp for something like 5 to 6 months.
6 months.
Did you have any food during the lockdown?
Any what?
Food.
Yes, there is food. This is the only one that the only thing that left for us. But do you know what is the most horrible thing that happened with the food during this time?
No.
The vulnerable people, the old people, the pregnant women, like the vulnerable people, used to go direct, like not being in the line to wait 3 hours to receive food. They go direct, receive them food by using a paper, like a document from UNHCR. During this time, they cancelled this paper. So all the vulnerable people, all the old people had to do the line with us for like 3 hours. First of all, they cannot make it for 3 hours. Second of all, if they will catch the virus from this food line, imagine 21,000 people receiving food from the same food line. So all of them will have it in hours, some hours, or like you will have it because like they go to the same place and they come back, they touch the same things.
Yes.
So they will die. The old people will die.
Yeah.
This is the most horrible thing that happened with the food, but yeah, we received food, but nothing else.
Okay. Yeah, so instead of evacuating this camp, there was already a crisis. They just completely closed it off for 6 months. A month ago, approximately, the fire happened in Moria.
What?
Yeah.
So they burned it. Not all of them. There's some people burnt Moria on this night.
Yeah. And the whole camp burned, and you saw in one night 12,000 people. They all had to evacuate the camp.
13,000 people.
Yeah,
we start to move from Moria camp
where did you
towards Matellini, towards the city center to Matellini. So on the way we have to pass by Moria village, it's a Greek village. We surprised there, we find fascists. They start to beat us. A lot of fascists. The police tried to control it, but they couldn't. Then they just left them. They tried to beat us. They beat us. So we were a lot, so we could pass this fascist. So we passed this fascist, and we found a checkpoint, police checkpoint, closing the road, blocking the road. So we were surrounding from behind fascists, from in front of police. So we passed this point again, and we found another checkpoint, and we stacked in this road between Benaude and Matellini.
Yeah, people just living on the streets, with no shelter, no food, no sanitation, and
no water, no toilets.
How long did that last?
10 days.
10 days.
Yeah.
10 days you just have to stay.
It was 10 days without shelter, cold 10 days, warm 10 days, 10 days without toilets, 10 days without medical care, 10 days without masks, the races of coronavirus, 10 days without food, 10 days without water. One night we were all of us super thirsty, super hungry. We were starving. but we didn't find anything. So in the end, the government came and they gave us expired food. And we were sick. And when we throw the food in the trash, there's a lot of people complained about that. Why you throw food? First of all, we didn't have a fridge like you. The food was expired. If we will eat it, we will get sick, and there's no doctors.
No.
So it was horrible, and there's a lot of newborn baby get sick because of the smoke of the fire, and then they get worse. The cold, it was super windy at the night. Until now, Greece go to the weather, and it's super windy at the night, super cold at the night, so warm in the morning.
Do you want to tell me something more about the new camp, or
The new camp,
yeah,
the new hell,
yeah?
the new hell.
Why are people so against the building of the new camp? New.
We don't need more memorials. We don't want more persecution camps. This camp is persecution with control. Like, look, the tent's supposed to be for 6 people, but there is 12 and 15 people living in the tents now.
Yeah.
Okay, it's in a shitty area. On the sea, it's super windy there and it's super cold. There is no running water, and there is only 1 meal a day. 1 meal a day.
And it's a closed camp, as I understood.
Now they want to calm the people down a bit, you know. They don't want them to burn the camp as well, and they don't want the outside people, like the European people, to act against this camp. So they let the people get out of the camp from 8 in the morning until 8. But when you go out, they ask you, where are you going? What time you will come back? What you will do outside? And the war says, if you don't come back in the time, they have the possibility to close your case. That means they can deport you.
Oh, wow. It's
control.
It should not be legal.
Where is the freedom? Like, you cannot leave a place.
No, there is no freedom.
So about the single people, they are not even allowed from 8 to 8. They are allowed from 12 to 8.
You have
So
single
people on the bottom. Huh?
You have no freedom, no humanity, no water.
And do you know what? They build the big tents for the single men.
Yeah.
In each tent there's 150 single men sleep in it.
And for how many people they're supposed to be, these tents?
I don't know, but it's like if you see them, like they sleep together, they are sharing the same bed. Then there's this tent, like around, like maybe half meter, maybe 1 meter between the other 4 beds. So even if one of them will get the virus, all of them will get the virus.
All of them.
Let's talk about the people who have coronavirus, who tested and tested positive. They put them in the middle, the center of the camp. The same tent, surrounding by barbed wire. And the other people in touch with them, you know, there's a lot of refugees, they don't believe like there's coronavirus or there's something.
There is not enough information.
Yeah, no one informed us. Like, I did a lot of interviews. I still have them, I didn't publish them yet. And all Moria, they said like, really, there's coronavirus case in Moria camp? I told them, yes, there's 35. They said like, I don't know, no one told us.
Yeah, they don't inform enough. No.
And also they don't believe, you know, they are far away from anything. There is no signal to like to see that online in the social media or something.
Yeah.
There's no TV, there is no one telling them about that. So they are in touch with them. And these people also having 1 meal a day. Imagine you have coronavirus, you need healthy food, you should be strong, they give you 1 meal a day. But shitty food sometimes expire. So also it's a project of death project. They want to kill the people.
Yousif, if you have any like closing words for the students who are watching you, what would you like them to know?
This is shame, but I would like them to know it's shame. It's obvious, it's shame. Like, this country is aimed for freedom, you know. They create this word freedom, you know. They create the human rights.
Yeah.
Where is the human rights?
All right. Ninke, you want to give message, and Stefan, you want to prepare sharing for your presentation?
Yes.
All right, everyone. So we started up a poll just because we wanted to see what kind of people we have in the audience. If everyone could fill that in, that would be great. Secondly, due to a small accident, it seems like a lot of people have been made into moderator. We are asking you not to click on anything during the presentation because you accidentally have these rights that you can change or flick through the presentation. We're asking you, please don't do that because it will disrupt the presentation. So please don't end the presentation or go through it. Thanks for all your responses. It seems like we have a majority of medical students, and I'm seeing some nice responses in the chat as well. Right now, we have Dr. Steven van de Vijver who's going to give a presentation.
Okay. Thank you very much. There was a very intense story by Yousif, and I think for me as a follow-up, it's I don't have half of the experience Yousif was telling about his journey, but I would just give you a brief overview of migration health, or so-called, what are all the difficulties and complexities around the health situation with refugees. So my name is Steven van de Vijver. I'm a medical doctor, work as a GP in Amsterdam, and before worked for MSF in Congo. I did my PhDs on NCDs in the informal settlements of Nairobi. And besides working as a GP in Amsterdam, the last few years I worked for BRF, Boat Refugee Foundation, in Lesbos, and I would love to share my experience as well. So this is what I would like to cover in the next 30-35 minutes. Is there any need for clarification? Just let me know. So I want to tell a bit about what's the background of refugee, how is this issue actually growing the last few years? What is the medical situation you find, and how's healthcare in these camps organized? And I think the complexity of care is something which is, I think, very essential to share with you. And as we are currently in the year of COVID, that's of course an essential topic to discuss as well. And like I said, we can have, hopefully at the end we have some time for questions or discussions, or otherwise I will hear it during the lecture. So if you look about it, there's a lot of semantics about migrants, refugee, internal displaced people, asylum seekers. You see in all these groups that this is growing rapidly. So last year it was already 80 million. In 2020 this has even grown. And although in Europe we sometimes have the feeling politically that we're in the center of refugee health, but as you can see, the top hosting countries, they're almost all outside Europe instead of only Germany. And also the top source countries, they're all located outside Europe, mainly in around the failed states like Syria, Venezuela, South Sudan. And as you can see as well, 40% of the world's displaced people are children. So what I saw also in Congo and Lesbos is there are lots of young families. People are still on the move, and these are also, most of the times the most vulnerable. So if you talk about refugee camps, and the last slide was from UNHCR. These are official refugees. But if you look at which are the situations where most refugees are actually currently situated, you have in Kutupalong, along the Bangladesh border with Myanmar. It's almost like 850,000 people, so it's almost close to a city of 1 million people. And these are all not officially registered with the UNHCR. And these are just official numbers. As you see this list, you can see that they're almost always close to one of these failed states. So you see with Dadaab in Kenya with more than 300,000 people. It's next to Somalia, and Kakuma in the north with South Sudan. You see also the camps along Tanzania, where refugees mostly from Congo, but also from Burundi, are staying. And you can see that some already there for more than 30 years, sometimes 40 years. So you have several generations already in the refugee camp. And it's also interesting to see how this integration goes, because you can see that Uganda and Tanzania are typical examples where there has been positive integration of refugees from Congo, for example, Katumba in Tanzania, which has been much larger than the current 60,000, and where many people have been integrated. Congolese even received Tanzanian nationality, which have partly dissolved as well. So these are specific refugee camps, but you see now more and more actually lots of refugees are not staying in camps, but also move towards big cities. So if you look, for example, to Nairobi, capital of Kenya, which is not in this top 10 refugee camp, but the estimates are that there are definitely 40 to 50,000 refugees at least from Somalia and South Sudan. As people are looking for economic positions, and also look also to match and unite with the groups you see in Nairobi, lots of refugees as well. So that's not just Nairobi, also big other capitals. We talked about Moria, but a city like Athens or Thessaloniki, they have also lots of migrants, and most of the times these are actually unofficial. So if you talk about characteristics of the refugee camps, of course there's a big difference between all these different countries and settings, but actually the element of the overcrowdedness is something which is a consistent element. And due to that, of course, there's a poor hygiene and living circumstances, with also a nutritional status which is very low and resistance. This is sometimes actually part of the location they have fled from. So they were in dire situations, but sometimes it's also partly due to the journey they had to make with lots of challenges. But also had a situation in the camp, as Yousif was describing as well, is most of the times very tough. So also this might create lots of issues. Let me see. In the presentation, I will go back to my presentation. Let me see. So besides the physical challenges, there's also, of course, the mental challenges. You see that a large group has a traumatized background. Again, this ranges from the place where they fled from due to trauma, or Yousif described the killing of family members. Sometimes also the journey itself was full of traumas, and unfortunately also the refugee camps like Moria are also creating lots of trauma. So it's an element which is very important to keep in mind. So, for example, if you think about the fire which happened in Moria as well, fire is of course an incident wherever you are. It's a very intense incident, whether you are in the hospital in the Netherlands or a building somewhere else. But for example, Moria, you can see on the reactions of the people, lots of people are traumatized, and also, for example, food lines, these kind of situations where lots of people are cramped together. You can see that people are traumatized, which makes it sometimes very hard to control, and people can react differently than you might expect. So that's a very important thing to keep in mind. And that has, of course, a lot to do also with the insecurity and uncertainty they feel, and not just feel, but what also reality is. Because if you look, people who are now in Moria, it is very uncertain what happens, where they will move to. So if you look at medical situations, for the refugees, there are several challenges. First of all, because of the overcrowdedness and the lack of hygiene, there's of course lots of infectious diseases. So both in Congo, in Lesbos, but other camps as well, you can see that the biggest problems most of the times are still airway infections, but also diarrhea, skin infections like scabies, and it's very hard to treat that and also to prevent that, because people are sometimes 3-4 families with one tent, and it's very complicated to really get rid of that. Besides the infectious diseases, which are still number one, there's the big mental health element. Like I said, lots of people within the camp they suffer from PTSS, post-traumatic stress syndrome, fear, depression, but also psychosis come up. And besides that, you can also see that there is quite some substance abuse. So, for example, in Lesbos, you have this big group of unaccompanied minors, and you can see that once a month they receive a small amount of money. Most of the times, significant amount is used to take alcohol, of course, to minimize all the fear and to escape from the current dire situations where they're in. So also the substance abuse issue is a big problem. And of course, the underlying diseases, the NCDs. This depends also on which situation you are. There's a different situation from South Sudan or Somalia, but specifically refugees from Syria, from Afghanistan. You see also that there's a quite big prevalence of hypertension, diabetes, asthma, which are often badly controlled, sometimes suffering from exacerbations. And this is also a big challenge, as the medical possibilities are really limited. Violence is an important element, and again, this sometimes comes from the situation they have been fled from, where people have been, for example, like Yousif said as well, part of the battleground where they had severe violences, stab wounds, but also during the travel, lots of violence is happening. And unfortunately, also Moria is infamous that also at night sometimes still women are raped. There's a high rate of STIs, and that's also an important challenge they're suffering from. Depending on the location, you can also see that there are outbreaks of cholera, measles. Luckily, that was not a threat on Lesbos in Maria, but along the Congolese refugees in Congo itself, but also in the border countries, there's lots of times cholera outbreaks going on. That it has a continuous threat. And often, of course, it's a combination of all these factors, of both NCDs, infectious diseases, the mental element, violence, which all are combined, which makes it also very complicated for a healthcare provider what has the priority and where to start, because they all need care and attention. And how looks medical care in a lot of these places? Well, for example, in Moria, which is a relatively small camp if you compare it to the bigger groups I've shown in the slide before. But even there, you see that there are almost 10 different NGOs working on different elements, sometimes also non-health related elements, sometimes only on psychosocial help, but every NGO has most often their own expertise, but unfortunately they don't always communicate that well. So you see that they're sometimes functioning in their own bubbles and procedures. And also for refugees, it's sometimes difficult to know where they should be and how treatment is followed up. And there's not always proper communication and collaboration. I think there's lots of room for improvement. And that was actually also one of the reasons I went back to Lesbos to see there can be a mobile health record developed. Because what you see is that, for example, in Lesbos and Moria, all the data and when the prescriptions and the health files are all on paper, and they often get lost due to the dire situation with lots of rain and floodings. On the other hand, majority of the people have mobile phones where they sometimes watch the soccer and other elements. So it would be very logic. That's also what we try to develop, to have people their own medical file on their own mobile phone, so they can access all the information that has been shared by the NGOs, medications they take, either when they are in Moria between the different NGOs, but also when they move to other places, when they go maybe to Athens, Thessaloniki, or to other places in Europe. It's important that healthcare providers, and at least the patient themselves as well, know what their blood sugars, blood pressure, medication is about. And sometimes you can also even see that when we would be able to put it on a mobile health record, that there's a possibility to have so-called telemedicine. So I here mention X2AI, which is a group that offers mental health support through chatbots in Lebanon. So you see these kind of initiatives coming up. So hopefully through that, we will be able to not just provide care within the camp itself, but also on a more personal level. Yeah, this is a very important issue, I think, specifically a group of people, medical students, who are eager and motivated to help these camps. There is a very big complexity around the care. First of all, of course, there's a big language culture barrier. Yeah, that's also when you work in these places, you are depending on translators. And these translators are often also refugees from the camp itself, who work there voluntary or for a small financial support, which give you more insight, but sometimes also can distract you. They tell sometimes their own stories around situations and people. So that makes it very hard to find out what the real story of the patient in front of you is. And also, of course, there is lots of politics happening within the camp, lots of conflicts which were going on in the countries that they fled from, are sometimes taken even back to the camp where they are. So within Moria, there was lots of discussion about IS supporters within Moria, and that even at night were intimidating people. And that's very hard as a healthcare provider to know what is a rumor and what's the truth, and then how can you get this information. However, we know from the past, from other situations, that sometimes healthcare providers can play a discutable role in these settings. One of the most infamous examples is in 1994, during the genocide in Rwanda, that MSF supported the refugees in Goma, a camp of Hutus who fled from the violence of the Tutsis. And while giving medical aid, it was actually a camp where the Hutus were actually preparing a big fight back. And actually, while giving aid, this was fueling the conflict. And that was during that time, MSF found out and had to make a hard decision to actually stop the medical aid, because they realized that they were an important factor in the whole conflict. So that's something which is very important to keep in mind. And on the other hand, there's also the difficulty of the so-called disease gain. Disease gain is something that people sometimes might try to get something from a certain kind of diagnosis. I mean, that's happening also when you're working as a medical doctor here in Amsterdam or somewhere else. But you see that lots of migrants sometimes think that with a specific diagnosis, which is complicated, they will get, for example, Moria, a place to go to Athens. And that's also where the translators a lot of time talk about. They say, no, there's nothing wrong with this woman or man. She just wants to go to Athens. And it's very hard to know when or why are people thinking this, and what's the story behind of this. And of course, the lack of trust of these people towards institutions is extremely logical, and it takes time to build up a relationship of trust with your patient, also because it's very fragmented. I explained already before, there are many different NGOs, they go to different organizations. Of course, also the healthcare workers, they also have their shifts. They also work sometimes for a limited amount of time. They work just a few months, weeks. So it's very hard to get a good idea about what's happening. Specifically then, sometimes also the medical data get lost. And an important element, I think, is the burden for healthcare workers. So, like I said, many people are motivated and eager to work in these kind of places, and it's important that you're confronted with these complexities. And sometimes, yes, it's tough that you're confronted with all these political elements, which is not always stimulating or motivating your work. And it's important to also, that's not just with MSF or BRF, sometimes step back and don't work there 7 days a week, but step out and talk with your colleagues about all the things you see and do, to also make sure that your own mental health is in order. Yeah, then I want to briefly talk about the COVID threat, which is of course an essential element in this year. And when it all started, we had the example of the Diamond Princess, the big cruise boat. Then we thought it was the perfect place for spread of an epidemic, with 24 people with 1,000 square meters. But and if you look at, for example, the camp of Moria, it's actually 10 times more than populated. So it's completely not realistic to have the 1.5 meters in place, to have personal hygiene where you have to wait for almost an hour to get your hands washed. And there's lots of movements going on of refugees and healthcare workers. So there was a big threat, actually. And it was, when I was there in March, it was clear that it was going to happen, definitely. The question was more when than if. And it was not just in Moria, because we saw the first corona victims in refugee camps in Kutupalong in Bangladesh. And then, of course, it started in Moria as well. So I think Yousif gave already a very intense description of this place, which is very confronted to see that this is actually happening within Europe. When I was there were 24,000 people, and there are, like Yousif is saying, human rights are violated, and it's very bizarre to experience as a medical doctor that these places actually do harm people, and these are mainly refugees seeking for help, and instead of offering a safe space, you can see actually that we do increase the harm and the unsafety, and that was for me and my colleagues a reason to step up and start the action SOS Moria, because we had the feeling this actually crossed our oath of Hippocrates, that we actually are doing harm as Europe. So within a few weeks, more than 7,000 doctors from all over Europe supported this plea for the political parties to step up and do something about Moria, specifically with the threat of Europe. Actually, the only thing that would save people is a complete evacuation. Then within these few months, nothing really happened. Then, of course, it was crystal clear that when the first case started in Moria, within a week, the camp was on fire. Because, like Yousif was saying, the first patients, of course, afterwards, it spread very rapidly. It was impossible to protect yourself. And then people were aggressively and violently put into forced quarantine. And that night, actually, also the fire started. And within a few days, 12 to 14,000 people were actually sleeping on the streets of Lesbos. And this should have been this big tragedy, which of course we all could foresee. Everyone who was involved in this camp knew that this would happen. And it should be the perfect storm, but also then the reason to solve this issue, to have all these people transported to the mainland and put them in decent environments. Unfortunately, the follow-up was that they started to build so-called Moria 2.0 at a completely wrong location in the island, where there's a lots of risk of floods next to the sea, with barbed wire around it. So all the freedom is gone. It's, you can say it's a big prison, has become. And we have actually done a step back, and I think the importance to continue the call that this should be stopped is more relevant than ever. So I think it's very good that you organize a symposium like this to put emphasis on this topic, and that this is a rising problem within the continent and unfortunately also outside. And I hope that by hearing these amazing stories of Yousif, that we will be able to witness and act on this horrible situation. So this was my story. I hope to hear if there are any questions. Yes, well, thanks for the question. Indeed, the idea was when I was going in March to set up an e-health construction for people, that when I was there, of course, there was an ad hoc issue of COVID. So we had to stop to further develop this. However, last month, I had a meeting again with BRF, also with the medical coordinator, Valerie, who is working now in Lesbos. And they are very eager because specifically in these times, the medical care is very much spread out. And so the need to set up a mobile health record is very important. And the importance is now to actually start as soon as possible. And maybe it would not be this perfectly beautiful, technically sound device, but at least information that migrants can keep with them, and then which they can also share with other NGOs. So hopefully, I don't think this year, but hopefully next year we will put it into practice. Yeah, what do we see here? This last picture. These are actually all the clothes that were washed upon the shore. In the back, you can see the sea, the Mediterranean Sea. And these are clothes that are washed still on. This is also from a year ago. But it's very dramatic situation that on one hand this is this island which used to be a tourist destination where sometimes still tourists are, and then a few meters away you can see a very dramatic humanitarian disaster, which is sometimes difficult to comprehend. This is, I think, a symbol of that. Let me see. I go to the chat to see if there are other questions about the photo. Psychiatric care. Yeah, that's what I said. Indeed, that a lot of times they attempt to get a psychiatric diagnosis. Well, unfortunately, I think that there's a lot of people with psychiatric diagnosis. Like I said, and the majority of people have fled their own place with a reason. Most of the times due to very intense trauma. So it's not just disease gain. Most of the time, it's even the truth. And there is psychiatric care on the islands and in the camps. But the difficulty is that it's still a very insecure place. So, for example, if you talk about treatment of EMDR, which might help in some cases of PTSS, a refugee camp like Moria is not a real safe place to give a treatment like that, because you might actually exaggerate or even complicate the trauma. So you cannot really start these kind of treatments in these kind of uncertain places. So that's why you can offer treatment, psychiatric treatment, but it's very limited. And also, if you talk about medication, it's important to have a real long follow-up. And sometimes people are moving to different camps, so that's almost impossible to do in these kind of places. So there is a specific support and treatment called METS, METS, developed by the group here in the Netherlands. It's really helpful, but it's just one small element, and you cannot have the real professional psychiatric care. The base is for me, because I think I've worked outside Europe for a few years. That this right now is happening here in Europe is for me, very difficult to grasp. And for me, it's not just giving care to the people over there, which is of course the main element. But I think also we should advocate for the people, for people like Yousif who stayed in these camps, and that we should not accept that. So I think that's also the reason for the second time we decided with these 7,000 doctors to unite our voices and speak up to the politics, because we should not accept that these kind of places in the first place are happening in Europe. And of course, and they should not be there in the whole world, but at least in Europe, I think we should definitely make sure that this should be history. Okay, I think after 1 hour, maybe people, I'm already taking part of your break. Thank you very much for listening, and on this beautiful Saturday, and hope it will inform you and inspire you to maybe also go one day and provide assistance. Thank you very much.
Thank you very much for your presentation, Steven. And it was also very good to hear the story of Yousif during this symposium as well. Right now we're about to pause for a short break, but before we do that, I'd like to invite everyone to donate to Legal Centre Lesbos. They're a charity that provides legal aid for those currently in camps of Lesbos, and they're also actively working to hold the European Union, the Greek government and local governments accountable for what is going on there and representing refugees. We've added a link into the chat box, which you can see to the right, and there's also a QR code for those with cameras on their phones. And any donation you can give would be much appreciated. And as this symposium is free, this would be a nice way to contribute. But otherwise, I'll let everyone have 5 minutes break to grab a coffee or a tea, and then in 5 minutes' time we'll be joined by Nasratullah Ansari with his presentation.